your local station.
Millions of people suffer from frequent numbness, tingling, or pain in different parts of their body. It is often diagnosed as peripheral neuropathy. And while there is no cure, there are cutting-edge treatments to help you live your life pain-free. Here to tell us more is Dr. Logan Swaim. He is the founder of Roots Neuropathy. Great to meet you, Dr. Swaim.
Great to meet you. Thanks so much for having me.
Let's start with the medical definition so everybody understands what we're talking about. What exactly is peripheral neuropathy?
Oh, peripheral neuropathy is actually a condition that affects over 20 million Americans. It is specifically nerve damage to certain areas caused from a variety of different things, from diabetes to autoimmune conditions. More importantly, toxins like chemotherapy and Agent Orange. So really focusing in on the fact that there's over 100 different causes of that nerve damage.
Boy, that's hard if 100 different things can cause something. When it's happening to people, what kind of symptoms do they experience?
Some of the biggest ones that we see in the office are numbness and tingling. That's probably what people experience the first aspect, feeling of wearing socks when they're not, but also shock-like sensations. Those all come into play when we look at addressing some of the underlying issues. So it's more than just the numbness, but as we get older, it's a coordination and balance issue. So definitely a big thing when it comes to falls.
Okay, well now when you talk about nerve damage, just so we understand it from the physiological point of view, what exactly is happening inside our body to be causing these type of sensations?
So the nerves and blood vessels are actually dying off. We lose nutrients, we lose different things, and it ultimately comes down to a circulation issue. So as we get older, we lose that ability to heal and regenerate. So we are able to reverse that process naturally, and that's how we're able to address the decrease in nerve and blood flow.
Okay, so obviously the key word is naturally. Tell us about your treatment methods.
So one of the things that we typically see in the office are the old antiquated models of drugs and surgery, where gabapentin and Lyrica are commonly prescribed, but we're not going to address it from that standpoint. We want to take a more natural approach, addressing and able to heal and recover those nerves using state-of-the-art technology. Cancer Centers of America use a device that we use, as also low-level light therapy. All of those are very specific in addressing and regenerating the nerves that have died.
Okay, so you're sort of addressing the nerve itself rather than just maybe masking the complaints and the symptoms?
Exactly. We don't want to just cover up the symptoms and hope the problem gets better. We actually want to take a proactive stance in addressing the underlying cause of why you're dealing with the symptoms that you are.
And no doubt that's not easy to do because you mentioned there's hundreds of causes why you have these symptoms.
Right.
So knowing that you're going to have to do some digging to understand what's happening in individual people's bodies, what can people expect when they make an appointment to see you? Walk us through the process.
So it's a really comforting aspect. I believe in early and accurate diagnosis is key. So one of the things that we do is education is key in our process. We want you to understand exactly what's going on. So what we'll do is we'll actually sit down with you for a few minutes and really dive into what is it and how is it affecting your life. More importantly, if we don't address it, how is it going to affect you in the future? So that consultation is vital when it comes to addressing how we address the 100 different causes. But then that thorough exam, there's very few aspects when we look at other offices and how thorough we actually are in our exam process. We're able to get down to the exact percent sensory loss through our exam process to determine what treatment options are necessary. So we run through a very extensive process, and then to be able to sit down with you and go over those recommendations, that report of findings, to really evaluate what's best for your health.
Is there anyone that is not eligible for this type of treatment? Do you get to a point where there's a percentage loss that simply can't be helped?
Yeah, unfortunately, we see this too often. People wait too long. And really, once we get to an 85% sensory loss or more, we can still help, but it's simply a managing of symptoms, which is why it's so important to address it early. So just because you go, hi, my hands are numb, I'm not sure what that is, I still encourage you to make an appointment, to find out that area and really address it. Because once it gets too far along, it's really tough to be able to bring that back, which is why early and accurate is very important.
Some really good advice there. I know a lot of people experience things and just think, oh, well, it's just part of aging, but maybe it's something that you can do something about. If you would like more information about neuropathy treatment, you can go to therootsneuropathy.com for more information. They're located in Lakewood Ranch, and Roots is offering a $49 special for the first 25 appointments. So go ahead and check it out. When we come back, we're in need of some volunteers here on the Sun Coast, calling all soccer fans.